infection. Again, peramivir should only be used within the hospital setting. It should not be used in clinics or outpatient setting. It is an IV form, and it is indicated for adults for the following reasons: patient who is not responding to either oral or inhaled antiviral therapy, such as Tamiflu and Relenza respectively, and also the drug delivery by route other than IV, for example, enteral Tamiflu or inhaled zanamivir, is not expected to be dependable or is not feasible, for example, an intubated patient. Okay? And the clinician judges that IV therapy is appropriate due to other circumstances. It is also indicated for hospitalized pediatric patients, and for these patients when they're not responding to Tamiflu or Relenza. And again, the drug delivery by route is found to be most accessible by IV versus oral or inhalation. Okay. There are bold-face do not use peramivir in the handout that I provided for you over there. And of course, peramivir should not be used for the treatment of seasonal influenza A and B virus infections, for outpatients with acute uncomplicated H1N1 infection, or for pre or post-exposure chemoprophylaxis of influenza. It should not be used for treatment of H1N1 virus infection in those who are documented to be highly resistant to Tamiflu, because it is within that same class and may, of course, lead to resistance to peramivir. The adult dose is 600 milligrams IV every day for 5 to 10 days, and of course infused over 30 minutes. The pediatric dosing, please see the handout. It's been passed, and there's also recommended doses for those with renal impairment. For your information, the infusion rate for pediatric dosing should be over 1 hour versus 30 minutes. Okay. And it only is available in one vial, 200 milligrams per 20 cc's. Common adverse drug events that have been reported are diarrhea, nausea, vomiting, neutropenia, which is rare, something to monitor the baseline CBC for. And of course, it is renally cleared, similar to Tamiflu and Relenza, so we need to adjust the dose for renal impairment. Okay. So in summary, the key points on H1N1. The vaccine is recommended for pregnant women, healthcare workers, household, those who have contacts with children 6 months of age and younger and who are symptomatic, children or young adults from 6 months to 24 years, and people between the age range of 25 to 64 years with underlying medical comorbidities. The preferred medication, again, is Tamiflu, and prophylaxis is 10 days, treatment is for 5 days. But what I'm seeing clinically is that some ID physicians are leaving it beyond 5 days for treatment. Have you seen that in your hospital settings too? And I don't know where the evidence is, and I don't know when they're planning to discontinue the drug, but I'm seeing it extends to even 21 days. Mm-hmm. Of course, people with severe egg allergies should not be receiving the H1N1 vaccine, and most importantly, to practice clean personal and preventive hygiene and behaviors. Okay, so I thought this picture was cute because in a way with the global pandemic, we should not be scared. We should not ostracize those who are infected with H1N1 infections. We do, of course, need to use good personal hygiene, cover our noses, our mouths whenever we cough or sneeze, and we shouldn't alienate those who are being sick, and we should treat them.